fundamental changes we need to make accordingly. Now, there's one other big reality about making the system more efficient, which is why what everyone here is talking about is so critical. And let's just pick an average American born in 1964. That average American born in 64 will retire this year at age 61. If just that one group of people born in 64 could work 3 years longer because they're healthy, because they feel like they want to do it, because they feel vital and vigorous and they're flourishing, just that 1 year working longer is $1 trillion to the U.S. GDP, and is $300 billion of tax revenue to pay for a lot of the problems that people are concerned about. So it's not just keeping people out of the hospital, getting them to thrive and flourish that makes what we're doing so critical today. I think there are a lot of realities to how healthcare has gone. Unfortunately, the system is frozen, and it has been for many reasons, despite efforts in the first administration. It's frozen in time, so it cannot address the quality lags that exist. While Netflix and Airbnb and Uber drivers are racing ahead, making arrangements, identifying the problems that are challenging us in healthcare have become incredibly difficult. You can't make appointments. The average Americans are tired. They're tired of waiting for a doctor's appointment. They're tired of waiting for the surprise of what your hospital bill is going to offer. That's being addressed by one of the president's executive orders. They're tired of waiting for access to their medical records. You own your medical records. They're yours. Why you can't have access to them is a stunning reality in modern day America. They're also tired of waiting for Washington to take action. And this president early on emphatically stated that wasn't going to happen anymore. And today we made that vision into a reality. And there's a fine line between vision and hallucination. What you did today was show it's a vision, because you share it with us and we're moving ahead on it. And that's what today's commitments essentially are reflecting. And they are pledges, they're not laws. They're nimble and they're fast and they're quick, because the president understands that you, each of you in your own way, understand these needs. And Secretary Kennedy spoke beautifully about the reality of what happens when you actually have electronic records, because what he said is happening in Indonesia, we'll have here. Within a year, on your device, and 91% of Medicaid patients have smartphones. On this device, you'll get insights based on your records if you want. You don't have to take this, but if you desire, Amy Gleason is one of the smartest people I've ever worked with, has built a mechanism to be able to get you that information in a way with all these partners helping, so that you can get nudged to pay attention to what you're eating and avoid processed foods. Secretary Kennedy smartly and wisely highlighted is so dangerous to our well-being. All of this, by the way, is that will be at the fingertips. In addition, advice about which doctor to see, when to go see them, nudges, reminding you why I didn't do certain things. If you're a doctor like me, it's a very different story. It's to help you navigate the system better. It's giving you advice, decision support, which is becoming increasingly important as medicine gets more difficult. But I'll tell you the best thing of all, how many of you have been with your doctor telling them something heartfelt, very emotional, and they're looking to the side, typing into their computer, right? It's common. Put your hands up. I just want to see it.